In this video, we'll discuss about pharmacodynamics. PD. What is PD? Effect of body on the drugs. So, effect of body on the drugs. Now, telling effect of drugs on the body. Patient is taking the drugs via oral route. The drugs is going to inside, after that getting absorbed. Okay, here it getting absorbed, then reaching to that blood. Now it reaching to blood. Now the drugs is going to site of action. This one is the site of action. Then it shows it mechanism of action. After that it get metabolized. Okay, after that it get metabolized and excreted. So that one is pharmacokinetics. Now discuss that mechanism of action. Here what is the mechanism of action of the drugs? That is known as pharmacodynamics. What is pharmacodynamics? What is the mechanism of action? So let's start that pharmacodynamics. That is effect of drugs on the body. So what is the drugs is going on the body? So what the drugs is going on the body? We have headache, migraine. Drugs, for that we want the drugs is go inside that granule blood vessels and bind with the receptor and to treat us. If we have diarrhea, okay, if we have diarrhea or constipation, we want the drugs to get absorbed, go into the blood. From blood it go into that intestine, bind with the receptor. So it a mechanism of action. So different drugs having different receptor, different drugs for different treatment. Here important one is that receptor. Important point here, that receptor. This one site of action, these two things are receptor. All the drugs have act via receptor. Okay, all the drugs act via receptor. The target organ is having receptor. So this is the drugs presented in the blood. Now the blood is going to everywhere. For example, I am having headache. I am taking the drugs for that migraine. So drugs is presented in the blood. And now from here, okay, it is presented here. The drugs is going to everywhere. Everywhere will act only on that cranial. Now we are taking headache, so it will reach to cranial blood vessels, not anywhere else. Okay, why? Because the receptor for the drugs is presented. Particular organ only having particular receptor. If I am taking diarrhea, the drugs will act only, not anywhere else. Okay, the drugs is having that particular receptor on that particular organ. So here we will talk about that receptors. So pharmacodynamics is all about receptors. Let's understand the receptor, because drugs act via receptor on the target organ. Different drugs having different target organ. Each receptor having two properties. One, so pharmacodynamics all about that receptor. Let's we have understand that receptor, because drugs act via receptor on the target organ. Different drugs having different target organ. Each receptor having two properties. One is affinity, second one is intrinsic activity. Can you see this diagram? understand, this one is the basic diagram. This one is the cell membrane. Okay, this cell membrane having a receptor. Okay, so in this one it is a cells. Okay, cells of target organ. The cells can be brain, it can be intestine, or it can be heart, it can be kidney or liver. Okay, and this is the drugs. Drugs is presented in blood. From the blood, the drugs will go to the target organ. It will go to the target organ and bind with the receptor. This one is the receptor, so it will bind with this receptor. That receptor are presented on that cell membrane. Where it is presented, the receptor are presented on that cell membrane. So can you see, this one is the cell membrane. Okay, this one is the target cell, this one is the receptor. Drugs will come. Okay, these are the things, drugs. The drugs will come and bind with their receptor. So here, by using this one receptor only, it will bind. So these are the things, 1 2 3, these are the things are drugs. The drugs is coming and binding with this receptor. The binding is known as affinity. So the binding, coming and binding, that process name is called as affinity. So what is affinity? Drugs is coming and binding. Affinity is just binding, that ability of the drugs to combine with the receptor. So here combine, here come and binding is affinity of the drugs. What is affinity of the drugs? If the drugs come under binding, suppose the drugs want to act, the drugs want to show their mechanism of action on that particular organ, the drugs should come and bind with that receptor of that organ. If the drugs not binding, but drugs cannot act, drugs cannot act, drugs will come and bind. So binding is affinity, binding is done. Here come and binding with this receptor. After binding, it will activated. Okay, after binding, the drugs will activate that receptor. That activation is known as intrinsic activity. So drugs will come and binding here with that receptor name is called as affinity. After binding, it will activate, that process name is called as intrinsic activity. So that first the drugs will come and bind. So binding is called affinity, and after binding it will activate. That activation is known as intrinsic activity. So summary, affinity, drugs come and bind. That intrinsic activity, activation of that receptor. Next, based on the intrinsic activity, the drugs are 4 types: agonist, partial agonist, antagonist, and inverse agonist. So what are the 4 types based on their intrinsic activity? Agonist, partial agonist, antagonist, and inverse agonist. Based on their intrinsic activity, drugs are 4 types. Suppose this is that target organ, the drugs is presented in the blood. Drugs want to go on the target organ and bind with that receptor. It will bind with this receptor on the target organ. So the drugs to go here and bind with that receptor first, and then only activated that receptor. But this receptor is not natural receptor. Okay, this receptor is not natural receptor for the drugs. So this receptor is given for some physiological agonist. Okay, so it will give some physiological agonist. For example, so physiological agonist, for example, if that receptor is for acetylcholine receptor. Normally acetylcholine receptor come and bind here. Okay, so the receptor is alpha or beta receptor. So adrenaline come and bind here. The receptor is um, muscarinic receptor. So acetylcholine bind here normally. So different type of receptor are therefore different physiological agonist, but now the drugs is present, so based on their intrinsic activity. So based on their intrinsic activity, four type of drugs. Okay, so what are the first one is agonist. What is agonist? Agonist will bind that receptor and activate maximally. Okay, it activate maximally like that physiological signal stimulate. Okay, physiological signal molecules like physiological signal. So this one maximum activation name is called as agonist. Second one is partial agonist. Again the drugs will come and bind with the receptor, but it will activate not completely. Okay, not completely, it activate sub maximally. Here that antagonist, it was activation, here maximum activation, here sub maximally. That's why this one name is called as partial agonist. So binding process, this one is that the receptor, this one is the drugs. This is the drugs coming and binding. After binding, four possibilities. First possibilities name is called as agonist. Imagine this one is the receptor, is muscarinic receptor. Muscarinic receptor normally acetylcholine come and bind. Okay, acetylcholine come and bind, but now the drugs is coming. There are four possibilities. First option, drugs is coming and binding and activating, so it will activating maximally like acetylcholine do. So this is known as agonist. Okay, it is maximum activation like natural agonist. So second, how that physiological agonist, that is acetylcholine do so. The second one is four process. First one is agonist, second one is partial agonist. That is acetylcholine do so here the second is partial agonist. The drugs is also coming and also binding, is also activating, but not maximally, it is sub maximally. So we are calling this one not maximum, first one only maximum. So it have that name agonist. Partial means not completely, not maximally, it is partial, sub maximally, so it is called as partial agonist. Third drugs is called as antagonist. What is antagonist will do? Antagonist will also come and it will bind, but they do nothing. Here not doing anything. They neither activate nor deactivate. They do nothing. Here just bind and block it. Here blocking only. What is the purpose now? Antagonist is just coming and binding, not do anything, neither activating receptor, no, neither deactivating, no. So here don't do anything, it is just blocking. Antagonist or blockers. So now the natural or physiological stimulus cannot come and bind. Who is the physiological natural stimulus for this receptor? It is muscarinic. So normally acetylcholine come and bind here. Now this acetylcholine will not come and bind because it is blocker. It is a blocker only. Then now acetylcholine will not show their action, so it is just a blocker only. Okay, then antagonist, and the last one is called inverse or reverse antagonist. The drugs will also come and bind with the same receptor, but it will do the opposite as that of that natural physiological stimulus. So suppose here acetylcholine bind coming and binding here, it will increasing that secretion. So this will come and bind and decreases that secretion. There increases, here decreases. These are the four major. First one is, what is the first one is agonist, here maximum activation. Second one is partial. Third one is blocker, not doing anything. Fourth one is reverse, minus. So we can say this agonist have that intrinsic activity +1. Partial agonist have intrinsic activity not +1, nearly, okay, not complete one, so less than 1. Third one is antagonist have intrinsic activity just below, okay, here just blocking only, just blockers, so 0 only. Coming, binding, not activating anything, not activating and deactivating, so blockers only 0. So last one is inverse antagonist have that activities here -1, have that intrinsic activity -1. It is sub maximally, it's okay, reverse only, okay. So by using intrinsic activity, agonist +1, partial agonist less than 1, antagonist 0, inverse antagonist -1. So what is antagonist? It bind and activate maximally, so +1. Partial antagonist, it bind and activate sub maximally, so less than 1. Antagonist, it bind but not doing anything, just blocking, so 0. Fourth one is inverse antagonist, a natural and physiological stimulus do not come and bind, okay, decreasing that action of that antagonist agonist. So here decreasing that action, so here no activity, because of that reason -1. So what is the summary? This one bind that receptor and produce that opposite effect, that reason only -1. So what is the summary? Suppose this one is the cell membrane, this one is the receptor, drug A, B, C, D, okay. The receptor presented on cell membrane, this is the drugs coming and binding, okay, coming and binding. This is the drugs A, drug B, C and D, 4 type of drugs. There are based on their intrinsic activity. Normally that Z, okay, the natural physiological agent, here we consider the Z or natural physiological agent which come and bind on that receptor. Z or natural physiological agent. So A is the drugs which is coming and binding here, coming and binding here and stimulating that receptor. In this way, like that Z do maximum stimulating here, maximum stimulating it. So intrinsic activity maximum, that is +1. B is also stimulating receptor but not maximally, like Z only it is stimulating but a little bit lower side, so less than 1. C is also binding, okay, but not activating, not activating. So this one not activating also, deactivating also, just blocking. So it is a blocker. So here 0 not coming and binding, so it this one is the not activating, so 0. Finally D coming and binding that receptor, doing reverse of that Z was okay, here decreasing the concentration, so that meiosis concentration decreasing, so that reason opposite, so here 0. So this is the graph. See here intrinsic activity of okay, So this is the 0 intrinsic activity. This is positive side, this one is the negative side. So first one is agonist. Okay, first one is agonist, positive +1. This one maximum 1. Second one is second above the 0, not maximum reaching 1, above the 0. So partial agonist. So less than 1. So second above 0 but not maximum +1. This is partial agonist. Third one is just 0. Okay. So agonist just 0 and -1. Okay. This one is inverse agonist. So you can get this graph. ஸோ இந்த வீடியோவில் ஃபார்மகோடைனமிக்ஸ்னால் என்னென்னு சொல்லி பார்த்துருக்கோம். இதில் வந்து எஃபெக்ட் ஆஃப் பாடி ஆன் த ட்ரக்ஸ். ஓகே, நம்மளுக்கு இப்போ ஹெட்டேக் இருக்குது அல்லது வந்து டயேரியா கான்ஸ்டிபேஷன் ஏதாவது இருக்குன்னா நம்ம ட்ரக்ஸ் எடுத்துட்டோன்னா அந்த பர்டிகுலர் ஆர்கன், சே ஃபார் எக்ஸாம்பிள் தட் கிரேனியல் பிளட் வெசல்ஸில் ரெசிப்டார் இருக்கும். கான்ஸ்டிபேஷன் அந்த மாதிரி ப்ராப்ளத்துக்கு வந்து நம்ம டேப்லெட் எடுத்துட்டோன்னா நம்ம இன்டெஸ்டைனில் வந்து ரெசிப்டார் இருக்கும். அந்த ரெசிப்டாரில் போயிட்டு இந்த ட்ரக்ஸ் வந்து எப்படி ஆக்ஷன் பண்ணுது அதை பற்றி பார்க்குறது தான் வந்து ஃபார்மகோடைனமிக்ஸ். ஸோ ஹியர் இந்த pharmacodynamics வந்து here we are studying about that receptor is presented in that particular organ. ரெசிப்டாரில் வந்து 2 ப்ராப்பர்ட்டிஸ் இருக்குது. ஒன்று வந்து அஃபினிட்டி, இன்னொன்று வந்து இன்ட்ரின்சிக் ஆக்டிவிட்டி. அஃபினிட்டினா வந்து என்னென்னா எப்படி அந்த ட்ரக்ஸ் வந்து பைண்ட் ஆகுது, அதுதான் அஃபினிட்டி. இன்ட்ரின்சிக் ஆக்டிவிட்டினா ஆஃப்டர் பைண்டிங் அது வந்து எப்படி ஆக்ட் ஆகுது அதை பொறுத்து 4 வகையாக வந்து கிளாஸிஃபிகேஷன் பண்ணியிருக்காங்க. அகோனிஸ்ட், பார்ஷியல் அகோனிஸ்ட், ஆண்டகோனிஸ்ட் அண்டு இன்வர்ஸ் ஆண்டகோனிஸ்ட்னு. இது வந்து த்ரூ பிளட் வெசல்ஸ், இது வந்து அசிட்டிக் மீடியம், இது வந்து ஆல்கலின் மீடியம் மூலமாக ட்ரக்ஸ் வந்து பிளட்டில் வந்து அப்சர்வ் ஆகிட்டு எந்த பர்டிகுலர் சைட்டு எந்த ஆர்கனுக்கோ அங்கே போயிடுது. அந்த ஆர்கனில் வந்து ரெசிப்டார் இருக்குது. அந்த ரெசிப்டாரில் வந்து இந்த ட்ரக்ஸ் வந்து பைண்ட் ஆகும். ஆஃப்டர் தட் ஒன்லி இட் வில் க்யூர் தட் பர்டிகுலர் டிசீசஸ். ஸோ இது செல் மெம்பரைன் எடுத்துட்டோன்னா இந்த செல் மெம்பரைனில் ரெசிப்டார் இருக்குது. இதெல்லாம் வந்து ட்ரக்ஸ். இந்த ட்ரக்ஸ் வந்து இங்கே வந்து பைண்ட் ஆகிட்டு அப்புறம் தான் அது வந்து ப்ராசஸ், தட் மெக்கானிசம் ஆஃப் ஆக்ஷன் வந்து நம்ம பார்க்க முடியும். தட் ரெசிப்டார் இம்பார்ட்டன்ட் ஒன், 4 டைப் ஆஃப் ரெசிப்டார் இருக்குதுன்னு சொல்லி பார்த்துருக்கோம். ஃபஸ்ட்டு ஒன் இஸ் திஸ் ஆண்டகோனிஸ்ட். இது வந்து பைண்ட் ஆகிட்டு அதோட மேக்ஸிமம் ஓகே இதை வந்து எக்ஸ்ப்ரெஸ் பண்ணும். ஸோ இன்ட்ரின்சிக் ஆக்டிவிட்டினா என்னன்னு சொல்லி பார்த்துருக்கோம். பைண்டிங் அண்டு ஆஃப்டர் பைண்டிங் இட் வில் ஆக்டிவேட் தட் ரெசிப்டார். ஸோ த ஃபஸ்ட்டு ட்ரக்ஸ் தட் ஆண்டகோனிஸ்ட் இது வந்து பைண்ட் ஆகிட்டு அதோட லெவல் பெஸ்ட்டாக காமிக்கும். ஓகே, ஸோ இன்ட்ரின்சிக் ஆக்டிவிட்டி +1. செகண்ட் ஒன் இஸ் இது வந்து மேக்ஸிமம் காமிக்காது அதோட தட் இன்ட்ரின்சிக் ஆக்டிவிட்டியை அதில் பாதி தான் காமிக்கும். அதனால் வந்து இது வந்து நியர்லி நாட் ரீச்சிங் 1, less than 1. தேர்டு ஒன் இஸ் வந்து ஆக்டிவேட்டும் பண்ணாது டீஆக்டிவேட்டும் பண்ணாது, ஜஸ்ட் பிளாக் பண்ணி வச்சுருக்கோம். இந்த ரெசிப்டாரை வந்து பிளாக் பண்ணி வச்சுருக்கோம். அதுக்கு நேம் வந்து என்னன்னு சொல்லி பார்த்தோம்னா ஆண்டகோனிஸ்ட்னு சொல்லி பார்த்துருக்கோம். ஃபோர்த் வந்து ஆப்போசிட் ரியாக்ஷன். ஓகே, ஹியர் டிக்ரீசிங் தட் ஆக்டிவிட்டி, தட் ரீசன் -1. ஃபிசியாலஜிக்கல் ஆண்டகோனிஸ்டுக்கு எக்ஸாம்பிள் என்னென்ன ரெசிப்டார்னு சொல்லி பார்த்துருக்கோம். இந்த 4 டைப் ஆஃப் ரெசிப்டார் அதோட ஆக்ஷன். ஃபஸ்ட்டு ஒன்று வந்து +1, பார்ஷியல் ஆண்டகோனிஸ்ட் வந்து less than 1, தென் ஆண்டகோனிஸ்ட் வந்து 0, ரிவர்ஸ் வந்து -1. ஸோ இதுதான் வந்து கிராஃப். இது வந்து 1ல் இருந்ததுன்னா ஆண்டகோனிஸ்ட், less than 1 இருந்ததுன்னா பார்ஷியல் ஆண்டகோனிஸ்ட், அகோனிஸ்ட். ஓகே, 0ல் இருந்ததுன்னா தான் ஆண்டகோனிஸ்ட். இது வந்து இன்வர்ஸ் ஆர் ரிவர்ஸ் -1. That intrinsic activity decreasing, so -1. This is all about pharmacodynamics. Thanks for watching.